Have you ever really thought about what goes into writing a prescription? It's so much more than just a signature on a piece of paper. Well, today, we're going to pull back the curtain on the prescriber's mindset and turn the complex science of pharmacology into a clear story about making safe, effective decisions with medicine. First up, we'll dive into the absolute must-know rules of prescribing. Then, we're going to follow a single pill on its incredible journey through the body. From there, we'll get into the art of finding that just right dose, and we'll see exactly why a one-size-fits-all approach just doesn't fly in medicine. And to wrap it all up, we'll explore the fascinating way drugs can actually hack our nervous system. So, what's really the difference between a prescription that heals and one that harms? It's not just about the drug itself, not at all. It's about deeply understanding the patient, the medicine, and that incredibly intricate dance between the two. That's what we're digging into today. Okay, so the very first step to any safe prescription is building a solid foundation of rules. And look, this isn't just about red tape or bureaucracy. This is about building a fortress of safety around every single patient. Every single one of these items on a prescription is a critical safety check. I mean, from the prescriber's info to the patient's allergies, each little detail helps make sure the right person gets the right drug for the right reason. You get one thing wrong here, and the consequences, they can be huge.
So who even gets to wield the power of the prescription pad? Yeah, it's not a free-for-all. State laws are incredibly strict about who has the authority to prescribe, and it's all for one reason, to keep patients safe while making sure they can get the care they actually need.
All right, so once that prescription is filled, the drug starts this amazing journey through the body. This is where we get into something called pharmacokinetics, which is really just the story of how a drug moves through you and what your body does to it along the way. Think of a drug like a package you've ordered. First, it has to get into your system, right? That's absorption. Then it's distributed to where it needs to go. Next, the liver metabolizes it, kind of like unboxing and breaking it down. And finally, your body excretes whatever's left over. We have a handy little acronym for this, ADME. It sounds simple, but trust me, the devil is in the details. And here's a fascinating twist in that journey, something called the first pass effect. See, when you swallow a pill, it goes straight from your gut to your liver. And your liver acts like a tough bouncer at a club. It can literally inactivate a huge chunk of the drug before it ever gets a chance to get to the party in your bloodstream. That's a big reason why a dose you take by mouth often has to be way higher than one you'd get through an IV. So all of this leads us to what is, honestly, the ultimate tightrope walk in pharmacology. Finding that just right dose. If it's too little, it's not going to do anything. But if it's too much, it could be incredibly dangerous. It's a delicate, high-stakes balancing act. This is where something called the therapeutic index comes into play. Think of it as a drug's safety net. A nice, wide index means you've got plenty of wiggle room. But a narrow index? That's a whole different ballgame. For drugs like digoxin and lithium, the line between a helpful dose and a harmful one is razor thin. Razor thin. And that's exactly why patients on these meds have to be watched like a hawk. But here's a total curveball for you. Sometimes the biggest threat to this delicate balance is hiding right in your breakfast. What if I told you that a common, everyday fruit could change absolutely everything? Yep, you guessed it, grapefruit juice. I know it seems harmless, but it can be a total saboteur in your medicine cabinet. Grapefruit blocks a key enzyme in your liver, which can cause the levels of certain drugs to skyrocket to dangerous heights. This affects everything from statins to antidepressants, and it can turn a perfectly normal dose into a toxic one. And grapefruit isn't a lone wolf here. Certain antidepressants, we call them MAOIs, can cause a really dangerous spike in blood pressure if you mix them with things like aged cheese or wine. Leafy greens rich in vitamin K can mess with blood thinners. Even a simple glass of milk can stop some antibiotics from being absorbed properly. This is why knowing about these interactions isn't just interesting, it can literally be a matter of life and death. But food, that's just one piece of the puzzle. The most important and most unpredictable variable in this whole equation is you, the patient. Your age, your current health, even your DNA can completely change the way a drug works in your body. I mean, just think about the world of difference between a baby and a grandparent. A child's organs are still developing, so they handle drugs completely differently. For older adults, their kidney function might be declining, which can cause drugs to build up. Plus, they're often juggling a whole bunch of medications at once. It's literally like prescribing for two different species. And pregnancy? That adds a whole other universe of complexity.
The FDA has a rating system to help doctors weigh the risks. But here's the catch. Most drugs have never actually been tested in pregnant women. So every single prescription is a calculated risk, a delicate balancing act between the mother's health and the baby's safety. Now, to help protect older adults, we have something called the Beers criteria. And no, it has nothing to do with beer. It's a life-saving list that identifies medications that could be risky for the elderly. This tool is absolutely crucial for preventing dangerous side effects like falls and confusion, things that are just far too common in this group. All right, for our grand finale, let's put all these pieces together. Let's see how these principles apply when we're talking about drugs that can literally hack the body's electrical grid, the nervous system. It really all boils down to two super simple concepts: agonists and antagonists. Think of an agonist as a master key. It fits a lock on a cell, turns it, and unlocks a specific action. But an antagonist, that's like a broken key. It fits in the lock, but it just jams it up, blocking any other key from getting in and starting the action. It's a powerful on-off switch. Our bodies are constantly balancing two competing systems, fight or flight, which revs you up, and rest and digest, which chills you out. Drugs can act like a DJ for your nervous system, turning up the volume on one and turning down the other to get a very specific effect. So what happens when you throw this balance way, way off? You get a full-blown crisis. And clinicians have this chillingly accurate little rhyme to remember the signs of blocking that rest and digest system too much. Hot as a hair, dry as a bone, red as a beet, blind as a bat, and mad as a hatter. It's a terrifying glimpse of what happens when the body's internal harmony is shattered. Let's make this real with a common class of drugs, beta blockers. They calm down that fight or flight response. Here's a neat trick to remember how they work. You have one heart, that's beta 1, and you have two lungs, that's beta 2. So a selective beta blocker is like a sniper, targeting only the heart. But a non-selective one, that's a shotgun, hitting both the heart and the lungs. For someone with asthma, that shotgun approach could be an absolute disaster. It's a perfect example of how choosing the right specific drug matters. And here is a warning you absolutely cannot ignore with beta blockers. You never, ever stop taking them cold turkey. Your body gets used to them, and if you suddenly pull the plug, you can get a massive rebound effect, like your blood pressure or heart rate going through the roof. It's like taking your foot off the brake on a steep hill. It is a recipe for disaster. These have to be tapered off slowly and safely. No exceptions. So you see, a prescription is so much more than just ink on paper. It's a story of science, of safety, and of deeply personalized care. The prescriber's challenge and their responsibility is to know every twist and turn in that story, to make sure that, for every single patient, it has a safe and healthy ending. Thanks so much for joining us.